Sarah. We're ready for the next part of your treatment, but first I need to explain to you the process of periodontal disease because we finished your assessment portion, and I will tell you about some risk factors, prevention, treatment, and then the process of this disease. Have you ever heard of periodontal disease?
No.
No? How about gum disease?
On commercials.
Commercials? Okay. Well, they are the same thing. Your periodontium, which is a really big word, is your tooth and all the supporting structures around it that keep it in its socket. So when you have a disease of your periodontium, it's periodontal disease. So there are two separate parts of this disease, and gingivitis you've probably heard of. They talk about it a lot on toothpaste commercials. And then periodontitis, which is a more severe and aggressive form of this disease. Gingivitis is the reversible part because it is just literally an inflammation of your gingiva, which is your gums. So it is caused by plaque, which is the sticky white substance that you try to brush off when you brush your teeth. It's the stuff that can make your breath smell bad, and it's full of bacteria. And it's the bacteria that's in the plaque that causes the problem. It makes your gums turn red, swollen, might be painful, and then when you brush your teeth you might see some blood. So that might be one of the first signs you notice, because blood when you brush your teeth or floss is not normal. No, it happens to a lot of people, but you shouldn't want that to happen. So, once you have gingivitis, just like you have, Sarah, it is reversible, and although you two are Siamese twins, you have different stages of periodontal disease. So Sarah, gingivitis, you will be able to reverse, and there's no permanent damage. But Tara, you have periodontitis, and luckily you came here and we caught it early, so we can stop it in its place. In periodontitis, there has been some sort of bone destruction. So the plaque has gone down and the bacteria have caused the bone to start to recede and break down. And if that started to progress even further, then you can start to have some loosening of your teeth, and that's when they start to fall out if it keeps progressing. Plaque hardens on your teeth and turns into what we call calculus or tartar. You need to come here to have it removed because it's so hard your toothbrush won't be able to remove it. So that is periodontitis and gingivitis. To diagnose these, we have a couple different things we look at. We've done your probing cups, and you guys are in somewhat normal range. You had about 1 to 4 millimeters. 1 to 3 is what we shoot for.
Okay.
Into 4 millimeters, that's when you start to have inflammation and bleeding. And then you had a 6 millimeter pocket in a couple areas. So after looking at your x-rays, we showed that there has been some bone loss. So we want to arrest your disease where it is so that you can keep your teeth forever. We can start just by cleanings. We recommend that you come 2 times a year to remove plaque and the calculus or tartar buildup. In your case, Tara, you will need to have scaling and root planing or non-surgical periodontal therapy, what we want to call it now. That's where we go below the gum line and remove this calculus and bacteria off of your root surface and help to heal all of those structures surrounding your root and your tooth. To prevent this disease, both diseases, you just need to brush your teeth twice a day and use fluoride. And flossing is just as important. When you brush your teeth, you want to brush your gums as well. Then floss probably just once a day. We recommend at least 3 times a week. I know it's hard to floss, but then visit us.
Very hard
for your floss. Yes, especially since you only have 2 arms for 2 people. And then don't smoke, because smoking is a really big risk factor for this disease.
Stop that.
So, here is a picture of healthy teeth, and you can see that the gingiva follows the margins of these teeth. And then this is just a really bad case of gingivitis. You can see it's red, inflamed. You can have bad breath with gingivitis. It may be very painless, or it can be painful when you brush and floss.
So that's where I'm at?
Yes, this is you right here. And then early periodontitis goes in. You can see there's little bit of gingival recession. So the gums have started to pull away from the tooth. And it looks like it might be painful, but it's probably not. This person probably has deeper probing depths and advanced periodontitis. It looks like those teeth might be mobile and shaky in their sockets. So you might hear that teeth just fall out with age, but that's really not true. It's a myth. If you keep really good hygiene, you will be able to keep your teeth forever. Do you guys have any more questions?
No.
I don't think so. Awesome. Thank you.